Ideas of federal panel on long-term care don't cover costs. NYTimes.com. Homepage. Today's paper video most popular edition, US/global. Search all NYTimes.com. Health World US NY/region Business Technology Science Health Research Fitness and Nutrition Money and Policy Views Health Guide. Sports Opinion Arts Style Travel Jobs Real Estate Autos. September 13, 2013, 9:36 p.m. Ideas of Federal Panel on Long-Term Care Don't Cover Costs by Judith Graham. The Federal Commission on Long-Term Care on Friday issued more than 24 recommendations meant to bolster services for older Americans and people with disabilities, but stopped short of endorsing a new public or private program to help families pay for home health care, custodial care, assisted living or nursing home services. "We're disappointed," said James Furman, president of the National Council on Aging. "They kind of ducked the most important issue." The commission was established by Congress last January after the demise of the CLASS Act, a voluntary long-term care insurance program originally part of the Affordable Care Act. It was given limited resources, an ambitious agenda and a very tight timetable. The first meeting was held in June, 3 months before the deadline for issuing a report. Many experts judged it a semi-serious, half-hearted effort on behalf of the Congress, Mr. Furman said. Yet how to pay for the rising costs of long-term care is a pressing problem. Public programs and families spent $317 billion on long-term care services, nursing homes, home health aides and so forth, in 2011, according to the Congressional Research Service. AARP estimates the yearly value of unpaid care provided by 42 million caregivers at $450 billion. More than 12 million Americans rely on long-term care services, and the number is expected to expand sharply as baby boomers age. Only impoverished older Americans and people with disabilities receive funding for long-term care through state Medicaid programs. Medicare does not ordinarily pay for long-term care. The Commission was tasked with developing recommendations for addressing this need. The report announced on Friday was passed by the Commission by a 9-6 vote. Among other measures, it endorsed the delivery of more long-term care services in community settings, rather than institutions, integrating long-term care more closely with medical care, improving standards for home care workers, and creating the standardized assessment of the need for services. But the members could not agree on a way to finance expanded long-term care coverage. In a letter to President Obama and congressional leaders released Friday, 6 commissioners emphasized their conviction that the Commission's recommendations should not increase the existing budgetary commitment to health care faced by both state and federal governments. Separately, 5 commissioners issued a statement strongly supporting a more robust publicly financed long-term care program. Judy Fetter, a professor of public policy at Georgetown University and commission member, was among those who voted against the recommendations because they did not go far enough. "The major challenge for dealing with long-term care is that we've got no insurance mechanism to protect families," she said. "In the short time frame we had, the Commission wasn't able to address this, and consequently we missed the ballgame." Dr. Bruce Chernoff, the Commission's chairman and president of the SCAN Foundation in California, the research group focusing on the elderly, saw reason for optimism. "The group's recommendations," he said, "represent a broad range of important ideas and solutions that could make a difference in the lives of vulnerable Americans today and tomorrow." A version of this article appears in print on September 14, 2013, on page A13 of the New York edition with the headline, "Report Issued on Long-Term Care, Disabilities, Elderly, Health Insurance and Managed Care, Home Health Care, Long-Term Care Insurance, Medicine and Health." Related posts. From the New Old Age. In California, intense debate over home care. High disability rates persist in old age. The curtain rises on the CLASS Act. Training needed for home care is lacking. Nursing homes seek exemption from employee insurance requirement. Previous post. The family says enough. Search this blog. Search. Previous post. The family says enough. Follow this blog. Twitter. RSS. Recent posts. September 13th. Ideas of Federal Panel on Long-Term Care Don't Cover Costs. The Federal Commission on Long-Term Care issued new recommendations on Friday, but stopped short of endorsing any new program to help families pay for